Blood clots are a natural response of the body to prevent excessive bleeding when an injury occurs. But sometimes if they don't go away like they should, they can get stuck in your arteries or veins. This can lead to serious health problems like heart attack, stroke, and embolism. It is essential to recognize the warning signs of blood clots, to seek immediate medical attention, and prevent health complications. So if you are ready, let's get into 9 warning signs of dangerous blood clots. Number 1. Sharp chest pain. Sharp chest pain is also known as pulmonary embolism. If you suddenly feel out of breath and have sharp chest pains or trouble breathing without a clear reason, it could be because of a blood clot in your lungs. This happens when a blood clot breaks away from a deeper blood vessel in your body and travels to your lungs, blocking the blood flow. This is really serious as it can prevent enough oxygen from entering your bloodstream. If this occurs, seek immediate medical attention. Number 2. Walking cramps. Walking cramps are also known as claudication. Sometimes harmful blood clots can form in the veins or arteries of your legs or arms. This is more likely if you smoke, are overweight, or have diabetes. If you feel a cramp-like pain in your leg muscles when you walk and the pain goes away when you rest, it could be because of a blood clot. These pains usually happen after you walk the same distance each time and get better when you rest. You might also see your leg or arm swell up and notice that the sore spot is red and warm if there's a blood clot. Number 3. One-sided numbness. One-sided numbness, also known as ischemic stroke. Your brain is like the control center of your body, and it needs a good supply of blood and oxygen to work properly. Sometimes a clot can block the flow of blood to your brain, causing what we call a stroke. This can happen more often in people with narrow arteries due to plaque buildup. When this happens, you might suddenly feel like one side of your body isn't working like it should. Your face, arm, or leg might feel numb or weak. Plus, your head might hurt a lot because your brain isn't getting enough oxygen. Number 4. Basketball belly. Basketball belly is also known as a hepatic vein thrombosis. Blood vessels are like little highways in your body, and sometimes blood clots can get stuck and block them. If these clots end up in the veins of your liver, it can make it hard for your liver to work well, which causes your belly to swell up and feel tight, almost like a basketball. But this belly problem can also be caused by other liver issues and not just blood clots. So it's really important to talk to a doctor to find out what's going on. Number 5. Arm pain. Arm pain is also known as coronary thrombosis. Your heart is a strong muscle that needs a good blood supply too. Sometimes a clot can block a blood vessel connected to your heart, and that's where a heart attack can happen. If this occurs, you might feel bad chest pain that can also spread to your left or right arm. Number 6. Loss of vision. Loss of vision is also known as retinal vein occlusion. Picture the veins in your eyes like little pipelines that carry blood. Sometimes a clot can clog these pipelines, which can make you wake up with vision problems in one eye. Or suddenly your vision in that eye might get blurry. You might also notice a dark spot in your vision. Number 7. Irregular heartbeat. Irregular heartbeat is also known as atrial fibrillation. Atrial fibrillation causes your heart to beat irregularly and sometimes much faster than normal. This can happen because of a problem with your nervous system. When your heart doesn't beat right, blood can gather in your heart and travel to your brain, which might cause a heart attack or stroke. Number 8. Swollen feet. Swollen feet is also known as edema. If your feet and ankles become swollen, the skin becomes stretched or shiny, or you can leave a dimple on the skin when you press it with your finger. This indicates that there is poor blood circulation to the feet. Although this isn't always caused by blood clots, it can raise your risk of developing a blood clot because poor circulation can cause the blood to pool in the veins, causing platelet activation. Before we move on to the next point, please subscribe to our channel and like this video. Number 9. Varicose veins. Varicose veins are those veins in your legs that can look blue and twisted. This is a sign of poor circulation and loss of tone within the veins, usually due to high estrogen levels. Having varicose veins can increase your chances of getting blood clots. When blood gets stuck in those veins, it's not good. Sometimes it could even mean there's a deeper problem called deep vein thrombosis. Thank you for watching our video. Please subscribe and watch our next video.